So this Insta lecture would be on coarctation of aorta, and it's quite a big topic. So we try to divide into two Insta lecture. So in this first Insta lecture section, we try to understand what is coarctation of aorta, what are the differences between preductal or infantile versus postductal or adult type of coarctation of aorta, what are their complications, what are their association, and how does a patient of coarctation of aorta typically present, what is the meant by differential cyanosis, why there is brachiofemoral delay, why there is a discrepancy in their blood pressure between upper extremity and lower extremity, and all these aspects. So first thing first, coarctation of aorta is a congenital heart disease which is characterized by coarctation, which means narrowing or constriction of a part of aorta, typically the descending aorta. So if somebody asks you what do you understand by coarctation of aorta, your one sentence reply should be that this is a congenital heart disease which is characterized by constriction or narrowing of a zone of descending aorta. And this constriction is usually associated with some intimal hyperplasia and medial thickening of the aorta. Because aorta is a blood vessel, so it has intima and medial layer. So these changes in the wall of the blood vessel that causes this narrowing and constriction in the descending aorta, and that could pose some problem in the patients. Now there are two terms which you must have heard of. One is known as adult or post ductal type of coarctation of aorta, another is infantile type of coarctation of aorta. What is meant by these terms? Now the narrowing or the constriction of the aorta could occur proximal to the insertion of the structure which I want to show you here actually. So suppose this is a this is the patient's right atrium, this is the patient's right ventricle, and usually the blood is flowing, and there is a structure here is known as patent ductus arteriosus, PDA. Now patent ductus arteriosus, the insertion is occurring on aorta. Now if the constriction or narrowing of the aorta is before the insertion of the patent ductus arteriosus, then this is known as preductal. So the term preductal means that the constriction or narrowing of the aorta in the coarctation of the aorta lies proximal to the insertion of the ductus arteriosus in the aorta. Now what would mean, this is also known as the infantile type of the coarctation of aorta. So how easily the blood flows in this type? Try to understand this. The blood is first coming to the right atrium. To the right atrium, they're coming to the right ventricle, and as they're passing to the right ventricle to the pulmonary artery, here they have two choices actually. Either they can go along there, or they can come to along the patent ductus arteriosus to the aorta. Now as this area, the constriction is there exists which before this area. So what is happening, this area the blood pressure is typically low, so the blood would always move from the higher pressure to the lower pressure. So blood in this area, they would pass along the patent ductus arteriosus to the part of the aorta, descending aorta. Now what is happening in this area, that as the descending aorta, now this deoxygenated blood is coming, and this deoxygenated blood will move to the lower extremity. So the lower extremity, the infant would be having bluish discoloration, cyanosis, but the upper part is pink. So this is known as the differential cyanosis. So in these patients, you can expect the infantile variant, they can expect the presence of differential cyanosis when there is a presence of intact patent ductus arteriosus. Now there is another variant is there which is known as adult variant. I have drawn it for you. Adult variant is also known as post-ductal. What it actually means, that in adults, this patent ductus arteriosus basically becomes the ligamentum arteriosum. and the constriction is basically seen after the insertion of the ligamentum arteriosum. So this is after, this is left ventricle, this is the aorta, and this constriction is after the insertion of the ligamentum arteriosum. So that's why this is known as postductal. So basically the differentiation between preductal and postductal means that the constriction, if it is occurs before the insertion or proximal to the insertion of the ductus arteriosus or ligamentum arteriosum, we call it preductal. And if it occurs distally, the constriction, like typically seen in adults, we call it postductal or adult type. Now the concept is here is this, that as the blood is passing through the right ventricle to the pulmonary artery, and then through coming through the pulmonary veins to the left artery, left vein, left ventricle, left atrium and left ventricle. Now as the blood tries to pass to move through this constriction, they would be having difficulty. So less amount of blood would be going to the lower extremity because the constriction is here. And as a result, you would be expecting in these patients, the adult patients actually will be presenting with brachiofemoral delay. You can also present, this is the reason why as the less amount of blood is moving to the lower extremity, you can also expect that they would be having lower systolic blood pressure in the lower extremity. And that's why we usually see in the patients, we see in the coarctation aorta, we see the discrepancy in the blood pressure in the upper extremity and lower extremity, because there is a constriction or narrowing there, and the portion which is lying below the constriction, they are getting less blood supply. So basically the lower extremity in this condition, they get less blood supply, and that's why the blood pressure in the lower extremity would be low, which is supplied by the part of the aorta which is lying below the constricting portion or the narrowed portion. Now, few other concepts that you need to remember about coarctation of aorta, that they could be associated with a few conditions. If it is a female patient with coarctation of aorta, you should always rule out the coexisting Turner syndrome. They can also be frequently associated with Berry's aneurysm. And as these patients, this is a congenital disorder which typically presents with hypertension, and this is a uniqueness of that not many, I don't think any other notable congenital disorder, heart disease, presents with hypertension other than this. Other key points of this, that in adults they can also present with, they might be asymptomatic, they just present with hypertension and some complications associated with hypertension. That could be, might be having headache, sometimes they have epistaxis, they can have Berry's aneurysm rupture, and if untreated, these patients basically they die between 35 and the 40 years of age, unoperated cases in adults with severe coarctation of the aorta. And coarctation of aorta, other key points are that they are frequently associated with some other congenital heart disease. They could be associated with VSD, ventricular septal defect. They could be associated with bicuspid aortic valve. These associations are often seen in these disorders, and typically you should think of this, that where you get a very low, or you cannot feel the pulse in the femoral lesion, or there is a gross discrepancy in the upper and lower extremity blood pressure, and there is a patient who is having an hypertension and otherwise asymptomatic. In these cases, you should always rule out the possibility of coarctation of aorta. And just summarizing the basic, coarctation means the narrowing or constriction of the descending part of the aorta, and this is a congenital disorder which is typically seen 5 to 7% of all the congenital disorders, which presents with the constriction of the narrowing of the aorta. They frequently show association with Turner syndrome. They frequently show association with Berry's aneurysm. They could be associated with other congenital heart diseases, as I mentioned, VSD and bicuspid aortic valve. And they have some characteristic presentation. The hallmark feature is a discrepancy in the blood pressure in the upper and lower extremity. In the infantile type, they could present with differential cyanosis. They could have brachiofemoral delay. In some patients, they could be presenting with some leg pain or claudication also, because the lower extremity is not getting the adequate blood supply. And all these points you need to remember about these diseases, and the other points are discussing on the second session on the coarctation of aorta. Thank you very much.